Patient Scheduling Part 3, Guidelines for Scheduling Appointments, Scheduling Pharmaceutical Reps. It is important to meet with pharmaceutical and medical supply company representatives. Determine time allowed by speaking with the physician. Usually this is done during a lunch time. A lot of pharmaceutical reps will bring in lunch for the office. Scheduling software and materials. The choice should make scheduling run smoothly. It should be customized to the medical setting. It is there to ensure the patient flow runs well, and it's to make it non-stressful on the staff. You will find that increasingly all appointment scheduling is going to be done electronically. A few medical facilities that are smaller still are using appointment books, but most offices are using electronic scheduling. Appointment scheduling possibilities. You have single page with a single date. You have a week at a glance. That means that you can see one whole week of a provider's availability. And then you have multiple providers that you can see at one time. The schedule is a legal record. It is important to ensure the quality management of your facility. Appointment schedule possibilities indicate arrivals, no-shows and cancellations, as well as walk-ins. It includes patient appointments, providers' meetings, visits from salespersons. It's helpful when scheduling in work-in and emergency appointments. Okay, so like if a patient calls and says they need to be seen today and there's no necessarily any appointment availability, you can work it into the schedule. You can be transferred to a handheld computer for the provider's immediate reference as well. Computer software and hardware. You may schedule resources, equipment, examinations rooms, specialty staff, as well as patients and providers. It quickly locates the next available appointment. It may be a component of a total practice management system. It's easy to access the patient's information, and it has online systems. It can be securely encrypted, and it can handle prescription refills, emails, and laboratory results. Appointments, inpatient and outpatient admissions. Appointments for outpatient or inpatient procedures most often are made while the patient is in the facility waiting. Appointments might include endoscopic exams, specialized radiological procedures, maybe minor surgeries. Have a calendar available for the patient. Some of the necessary information that should be included is the name, address, and telephone number of the patient, name of a referring provider, details of the patient's insurance, identification number and social security number, and the urgency of the appointment. Make certain patients get essential information in writing, such as date, time, and place of the appointment, any pre-examination procedures, any that might make travel difficult. They may need to go for a pre-surgical examination, whether transportation will be necessary after the procedure, and when the results of any procedure will be known. Hospital admissions. Use the same procedure. If hospitalization is immediate, determine if the patient can return home for personal items and make other arrangements as necessary. They may also be completed with a surgery scheduler. Scheduling surgery or specialty exams can be stressful, so accommodate the patient as much as possible and be sensitive to their needs.